Meet Dan and Maria. Dan needs to go to the hospital for a scheduled surgery. Dan and Maria aren't concerned because hospitals are safe places, right? Unfortunately, not always. Hospitals are busy, complex places where many very talented and dedicated people do remarkable work and save lives every day. In hospitals with strong leadership and teams that work together, patient safety is a top priority. Strong teams reduce infection rates, put checks in place to prevent mistakes, and create strong lines of communication between hospital staff and patients and families. All people make mistakes, but when there's a good team in place, they can look out for each other. But some hospitals don't have teams that work well together or good leadership. When one person makes a mistake, there isn't a good team ready to catch that mistake, and the patient suffers. Communication breaks down and patients get harmed. Patients experience dangerous complications, recovery is slower, and some patients even die unnecessarily. Let's take a look at two of the most common harms patients face. These harms are mistakes with medicine and infections that could be prevented. More than 1 million times a year, patients in the U.S. are given the wrong medication or the wrong dose of a medication while in the hospital. Even the best doctor or nurse can make a tiny error with really big consequences. And every year, 1 out of every 25 patients develops an infection while in the hospital, an infection that didn't have to happen. The most shocking side of the hospital safety problem is that as many as 440,000 people die each and every year because of hospital safety problems. That's like the entire population of Miami dying unnecessarily. While many hospitals are good at keeping their patients safe, some hospitals aren't. Some hospitals have hidden dangers you should know about.
I'll never forget the day that my 4-year-old son Logan almost died in my arms in Royal University Hospital. We were sitting on his hospital bed when he let out a scream. And I knew that he shouldn't be screaming because he shouldn't have been in any pain.
A bag of potassium that was a concentrated, heavy concentration bag was hung instead of a diluted bag.
As a pharmacist, I know that when the concentration of potassium is too high, that it can burn. So I knew when I looked behind me and saw potassium hanging that the concentration Logan had been given was too high for him, and as a result could have killed him. I immediately locked his IV and I started to cry and shake with all the chaos going on around us.
I went over to the bedside and saw that she clearly was upset about something.
And he looked right at me and he said, "I have no idea what you're talking about, but I trust you and I know that you know there's something wrong. I'm here to help. Let's figure this out."
We rolled Logan down to the OR waiting room where we met up with the anesthetist. And come to find out, he didn't even know that Logan had a kidney condition. He wouldn't have required us to increase the potassium if he had known that in advance.
I firmly believe that everybody that day was working with my son's best intentions. I work in the system myself, and I saw errors. I've been involved in errors before, but the way Saskatoon Health Region handled this error has been incredible to watch. Their openness to understand that there are safety defects in the system and their openness to work with me and to try to fix them have been unlike anything I've experienced in my own healthcare career to this point.
The most important thing that I learned from this whole experience was that, first of all, we as healthcare providers need to talk to each other. We need to be able to listen to the families. If we are in a situation where we're not sure what's going on and we're not comfortable with the situation, we can't be scared to just push the stop button and figure out together what's really gone wrong.